Okay, I think we'll make a start. It's a couple minutes after 6:30. Welcome to everyone who's joined us this evening. This is our latest in the series of webinars, and tonight's topic will be about egg donation. My name is James Barr. I'm the Managing Director of Bridge Clinic in London, and I'm delighted this evening that I'm joined by Rachel Shepherd, who's one of our senior clinical embryologists, and Rachel will be imparting her knowledge this evening about egg donation. But before we start, I think a couple of items of housekeeping, just to let you know that this webinar is being recorded, and the video of this will be uploaded onto our website in the next couple of days. So don't worry if you've missed anything, you'll be able to go on our website and capture all of the pertinent details from there. Also, we have a question and answer session, so please, if you have any questions, just please put those questions into the Q&A, and then we will be able to deal with those either during the webinar, or there'll be a Q&A session at the end of the webinar. So without further ado, I'll hand you over to Rachel, who will begin her presentation. Thanks, Rachel.
Perfect. So good evening, everybody. Thank you for joining us. So my name is Rachel. I am one of the clinical embryologists here at Bridge Clinic. So I'm going to talk to you a bit about our egg donation programme and just give you a little bit of information in general about egg donation and sort of the top information that you need to know. So what we're going to go through today is firstly just what egg donation is, why some people might choose to go and seek fertility treatment with donor eggs, the relationship between eggs and age, general success rates, egg donation at Bridge Clinic, some general information about donors and donor anonymity, and then some important considerations for this kind of treatment, and then the general patient pathway if you were to go ahead and seek this sort of treatment. So what is egg donation? In its simplest form, it's when an individual donates their eggs for use in a recipient's fertility cycle. So what this would consist of is an egg donor having their ovaries stimulated with medication to grow several follicles, and the eggs within these follicles would then be retrieved through an egg collection. The eggs that we've retrieved would then be combined with donor sperm or partner sperm to create an embryo. And then these embryos are grown in the lab up until a certain point where we can assess better for viability. We pick the best embryo to transfer back into a recipient and hopefully create a pregnancy. At this point, then all other viable embryos can be frozen for future use. So within the UK, egg donation is strictly altruistic. So what that means is that donors aren't making any sort of financial gain from the process. They're doing it just because they sort of morally feel that they would like to do that. Donors can only be compensated for sort of loss of earnings, and this is strictly capped to a maximum of £750. So why might somebody want to use donor eggs? So there are several different reasons why somebody might come to this decision and also have this recommended to them by clinical professionals. So one of the main reasons would be a low ovarian reserve. So what that means is that generally when people are looking to go through fertility treatment, they will have some basic fertility assessment tests done. This would include, firstly, an assessment scan that would look at the uterus and the ovaries, and the ovaries would have a follicular count done, and what that just means is they're looking at how many follicles and therefore eggs we can sort of see growing in the ovaries. We would then also do a blood test, which is an AMH blood test. This again is just something that indicates what your ovarian reserve is, and we use those in combination to sort of see how successful we think an IVF cycle might be. For some patients, these may come back as quite low, which means that if you were to go through a cycle yourself, you're unlikely to achieve a pregnancy, and instead you may be referred to use donor eggs to increase those chances of success. So on from that, some people may not be producing any eggs at all. So this can be related to age or early menopause, or it can be related to things such as certain genetic conditions or after cytotoxic treatment. So this is generally things like chemotherapy. Some individuals may not have any ovaries at all, so in these situations they may have had them surgically removed for medical reasons. Some people will still be producing eggs, but may find that the egg quality they have is poor. So sometimes this would happen when a patient may go through a round of IVF themselves, but find through this that the egg quality was reduced, leading to things like reduced fertilization or reduced embryo development. And then finally, some people will have genetic conditions that they know they would pass on to their own children if they were to use their own eggs in treatment, and then may wish to use donor eggs instead to bypass this risk. So we discussed the different reasons for why people might use donor eggs, but one of the biggest reasons that people will often be referred for this is due to age. So as we age, the number of eggs that we have, so our ovarian reserve, does naturally decrease. So this means that if you were to go through fertility treatment, the number of eggs you'd expect to retrieve would go down. But also we see that after an age of about 35, the number of eggs that are aneuploid, which means that they've got an incorrect number of chromosomes, rapidly increases. And if you've got eggs that are aneuploid, then you also end up with blastocysts, which are embryos that are also aneuploid. So you can see of the graph that I've just popped here that at 35, we see about 35% of the blastocysts end up being aneuploid. Then you get to 45, and that sharply increases to over 80%. And the problem with this is that if you were to transfer an embryo at that point, the likelihood of achieving a pregnancy is reduced, risk of miscarriage is increased, and then the risk of chromosomal abnormalities is increased. So this is why we generally don't recommend. So at Bridge Clinic, we can't treat patients with their own eggs after 45, but we can then treat patients with donor eggs up until 50. So just a little word on success rate. So there's lots of data and information that you can see all over the internet that can become quite overwhelming. The general gist is that over the years, success rates in IVF for both donor eggs and for a patient using their own eggs have increased steadily. And the reason we've seen this is because of an increase in IVF techniques improving, just lab techniques in general improving, protocols improving. And at this point, so this data was taken from the HFEA. So the HFEA is our regulatory body. So they gather data from all clinics across the UK and publish this, so you can readily see it on their website. For patients who have gone through donor egg cycles, the pregnancy rate per embryo transfer is currently about 43%. And conversely, for patients that are using their own eggs, this is currently about 33%. So, so egg donation cycles are sort of consistently more successful than when patients use their own eggs. And this data to do with patient eggs would also include sort of all age ranges, all medical histories. So if we were to look at specifically people who may be being referred for egg donation treatment, the difference in that success rate would be even larger. So egg donation at Bridge Clinic. So we are now able to offer this treatment to patients, and we're doing this primarily through a collaboration with an egg donation agency. So New Life is the egg donation agency that we're working with, and they are based in the UK. They are responsible for recruiting egg donors and matching those egg donors with recipients. And they also will handle all donor compensation, so the £750 that I've mentioned previously. So New Life have their own fees for this service, but they don't take any of these fees until a donor has been selected. If you end up in a situation where a donor withdraws from the programme or their medical tests come back as unsuitable for donation, the agency will also replace this without a charge. And one other point for New Life is that they offer donor exclusivity. So what this means is that when a donor goes through a stimulation cycle and egg collection, they will have their eggs collected, and all of those eggs will go directly to the recipient. There's no egg sharing, so it won't be spread between recipients. So New Life would be the best people to speak to in terms of waiting times and expectations on that front. But they currently say that there's no current waiting list for Caucasian donors. But your waiting times will vary depending on the physical characteristics that you're looking for. So if they are a bit more specific, then you may be waiting slightly longer for that. At Bridge Clinic, we're also able to facilitate known donation. So this can sometimes happen if you have a friend or family member who would like to donate their eggs for your treatment. In these situations, they would just be brought into the clinic and assessed as any other donor would, and then you can kind of move on from that point. But obviously, not everybody is in that situation.
You're on mute.
Yeah,
There we go.
I've just muted myself. There we go. So just some words about donors and what we would expect from each donor that we're selecting. So this is quite heavily regulated. So again, by the HFEA. They stipulate that all donors need to be between 18 and 35 years old, and this is because of what we've previously been talking about with the increase in aneuploid eggs as you sort of get beyond 35, and this is to try and give you the best chance of success. All the donors that are recruited by New Life are UK residents and will have ovarian reserves that are within a normal range. So that will the normal ranges change slightly as you get older, but they will all be within sort of a normal healthy range. All the donors are non-smokers who are also healthy with no family history of any sort of serious or inherited diseases. Each donor will also go through a basic genetic screening. So what this means is that they would first have something called karyotype. This is when we look at the number of chromosomes that the donor has, just to ensure that nothing is being passed on to any donor-conceived children. They will then also be screened for some other genetic issues that are more specific to their ethnic background. So, for example, Caucasian donors will routinely be screened for many variants for cystic fibrosis. And this gives recipients a bit of reassurance about the sort of genetics that are being passed on to a child that they may carry. Donors are also extensively screened for infectious diseases. So there's a large panel that's done prior to donation and then post donation if any embryos are frozen. So if you are using a known donor, there is some flexibility with some of these parameters. And that's just obviously because it's somebody that you may have a particular relationship with that you want to specifically use for donation. So, for example, if they're somebody who's maybe 36, we may have some leeway in using that donor as your known donor. So donor anonymity. This is something that is quite a hot topic at the moment. So people may have seen this in the news recently. That so since 2005, donors have not been able to remain anonymous within the UK. So that means that this year is the first year that these donor-conceived children are now turning 18 as a result, and as a result can access much more information about donors. So what this will mean is that any donor-conceived child can access non-identifying information at 16. So this is things such as the physical characteristics of the donor. And when they reach 18, they can know identifying information. So this is things like the donor's full name and the donor's last known address. The way that they can find this out is through the HFEA. So every donor will be registered with the HFEA and all treatment cycles are reported to them. So a donor conceived child can then go and put in a request with them to find out this information once they've reached the appropriate age. And the reason behind this is partly an understanding that donor conceived children deserve to know their their background and where they've come from, but also it's a practicality in the sense that we're now able to access many at-home genetic testing kits where people are finding long lost relatives. So it's something that makes sense to start considering in the sort of modern world where people can find this information already, to kind of keep it more regulated and more direct proper pathways for people to approach this with. Donors conversely can also request some information that is non-identifying. So they are allowed to ask clinics how many children have been born from their donation, their sex and their year of birth. But beyond that, they then can't find anything else out. So just a few important considerations for donor treatment. Donors have no legal right or responsibility to any child that's born of their donation. Within the UK, there's a donor family limit in place that is 10 families. So what this means is that 10 different families can be created of potentially siblings, so multiple siblings. Most of the time with egg donations, people are not reaching that limit, just because obviously going through egg collections is quite invasive. So people don't tend to donate to the point where that really ever happens. But the reason that 10 families has been put in place for our country is to do with the size of the country and the impact it would have if you could create more families than that. So this is sort of an optimal to make sure that siblings don't kind of accidentally meet each other. So donors can also consent and specify to certain things, such as the number of years that their eggs and then embryos created from those eggs can remain in storage. So this recently changed to a legal maximum of 55 years. So it's important just to be aware that they're able to consent to that, but they may also consent to fewer years. But that's something that we would always keep patients informed of throughout the process. And then finally, donors are able to withdraw their consent to donation and to storage at any point up until their eggs are used in treatment. This is something that can sound quite scary, but it's something that's very, very infrequently ever encountered. And the reason for that is that donors are very, very well informed before they enter this process. So as a rule, all donors will go through something called implications counselling. And this is where they will discuss the implications of their donation, and it's to kind of explore their thoughts and feelings and ensure that it's something that they really want to do. So I'll go through a basic patient pathway for anybody that will be seeking egg donation treatment. So some people may be approaching the situation knowing that they want egg donation. Some people may have it in the back of their mind, but they're not completely set on it. Other people may just want to be assessed and see where things take them. So for these people, we would ask that they are registered with the clinic and book in for a first consultation and fertility investigations. So again, this would include an assessment scan and AMH. We may or may not do an AMH depending on the specifics of the patient. So if the patient was somebody who knows that they are not going to be approaching any sort of IVF treatment with their own eggs, there may be no need for this. And then we would also do a semen analysis if the patient had a partner who produced sperm. We would then see both patients in a second consultation, and at this point is where we make more of a plan for treatment. So we would discuss all the treatment options and whether egg donation was something that you would like to pursue. If it was, we would then refer on to New Life. At the same time, we would also be helping the patient through some other aspects of the treatment, so implications counselling session for themselves to discuss their thoughts and feelings on the treatment. And then also, if they were approaching this using donor sperm, this would be the time that we would guide them through purchase of that donor sperm as well. So once the patient has been referred to New Life, they will go through a donor matching process. During this process, New Life will then send the donor that they have selected to Bridge Clinic, where we will conduct a consultation and an initial assessment. So this will also include the screening that we discussed, the counselling that they would go through, consenting process, and then scheduling, so working out sort of when their cycle falls and when they're sort of ready to start. At the same time, the patient would be going through setup for their treatment cycle also. So this also includes their consenting and their screening. They will have an embryology consultation where they would meet with the lab team so that they kind of understand the more in-depth processes that go on in the lab. And once everybody is ready, we would then aim to synchronize the donor and patient cycle. So this would start with the donor beginning stimulation, and so the cycle should be synchronized with the patient, and then the donor will get to a point where they're ready for egg collection, and at this point we would then require a sperm sample to be produced from a partner, or we would thaw out donor sperm. We would then combine the eggs and sperm within the lab to fertilize those eggs to create embryos. Those embryos are then grown within the lab to something called the blastocyst stage, which is generally about 5 days of development. And then any embryos that are suitable will either be frozen or transferred to the patient. So we generally aim in these kind of cycles to only transfer 1 embryo. In some cases you can transfer 2, but anything that's left over and is viable can then be frozen to use at a later date. So in some instances, cycle synchronization may not be possible. So in these cases, all the viable embryos would instead be frozen and be used in a frozen embryo transfer cycle instead. So once we do freeze an embryo, it then has to go into quarantine for 3 months. So what this means is that after 3 months, the donor would have to return for a final virology screening to clear those embryos for use. And after this is done and we have the all clear, we're then able to set up the patient for a frozen embryo transfer cycle. So again, you would go through a consenting process and then scheduling based on your own cycle. So no need to match up with anyone else's cycle. And we would start on medication until your womb lining was ready to receive an embryo. At that point, we would then thaw out an embryo and proceed with an embryo transfer. So that's the general idea of how egg donation treatment can work at Bridge Clinic. If you are approaching this and think that you're ready to start the process, you can contact our admin team to look for an initial consultation. If you're still sort of feeling like you have some more questions and are curious about some processes, then you are also able to schedule a 15-minute call with one of our team, and you can do this just through our website. But failing that, I'm also open to answering any questions that anyone might have at this point. So thank you very much.
Thanks, Rachel. That was excellent. Yeah. There's one question here about the timeline. So how long, would the actual pathway take? Give or take. Obviously, every case is different, but what can you expect to be the normal, length of time for that particular donor pathway?
Yeah, so of course it's always going to be dependent on the donor availability. So this is the thing that will cause the most amount of waiting for somebody if they're sort of looking for something specific. If there isn't too much waiting time for donor matching, then the process sort of from start to finish, we could probably be looking at kind of a 3 to 4 month from sort of initial consultation to embryo transfer. But obviously there are things along the way that may delay that. So that's kind of, I think, a more best case scenario. But as you go through the process as well, you can be guided, and New Life is definitely the point of contact for ideas of how long it would take to match with your specific needs.
Right. And then I think one last question is, do you have to find a donor in the UK, or can you go elsewhere?
As in a known donor?
Yes. Yeah.
Yes. So you don't necessarily need to, but the main issue with this is that the donor would need to be within the UK for long enough to attend all of their appointments and go through their stimulation cycle. So if you had, let's say, a relative that lived in a different country but had the time to be able to sort of stay here and go through the whole process, then that could be possible. Yeah.
Great. I think it's a pretty short Q&A session tonight. But thank you very much, Rachel, and thank you for everyone else's attention. I hope you enjoyed the webinar regarding egg donation. As Rachel said, if you have any questions, please don't hesitate to give us a shout. You can contact the clinic, you can call in, or you can email us, and a member of the team will get back to you pretty quickly with the responses to your queries. Without further ado, thank you very much for your time this evening, and wish you a pleasant rest of the evening. Thanks very much. Thanks, Rachel.
Thank you, everybody. Bye.